Welcome back to Body Beautiful. We're going to be taking your calls with any questions about fillers for Dr. Lee. Here's the phone number, 800-440-4884. And again, we'll be putting the number for the doctor's office during and at the end of the segment, so be ready to jot that down. And any advice we give you today, you want a second opinion. I want to get this question in because this is kind of newsworthy. What is the new Botox? Tell me about it.
The new Botox is a new botulinum toxin A that has been approved for aesthetic use. It's called Dysport.
Dysport.
D-Y-S-P-O-R-T. It's by a different company than Allergan. And it's been available for use in Europe and Canada for years, but it's just been FDA approved here. And it functions a little bit differently in terms of administration, but it is purported to last a little bit longer and to be less expensive. So we're just starting to work with it, but we're really excited about having it.
I'm sure you're going to try it out yourself to make sure that it's good for your patients, right?
Yes.
Okay, I promise we take some calls. So let's go to Gloria from San Jose. Good morning, Gloria.
Good morning.
You have a question for the doctor?
Yes, I do. I was wondering, do they have any type of fillers when you have stretch marks on the arms?
For stretch marks, fillers really don't work well, unfortunately. They tend to look like ropey lines instead of stretch marks under the skin.
Well, okay, so there's a mystique about these fillers, the Restylane, the Perlane. I guess those are the primary ones
They're
we're talking
not
about.
magic.
Juvederm, is that another
Juvederm
one?
is another
Okay.
one, yes.
So they're not magic. What can't they do?
Well, they can't do things like repair stretch marks.
Okay.
And
Does anything work for that?
no,
Let's help
unfortunately,
Gloria out here.
there's nothing that really works for that yet.
Vitamin E, cocoa
No.
butter,
No.
all that. All right,
No.
let's go on to Joanne from Napa. Good morning, Joanne.
Yes, hello. Thank you so
Hi.
much for taking my call.
Sure.
I wanted to know if there was anything or what you would recommend for, like bags under the eyes.
There's a lot that can be done with bags under the eyes, and they depend on what the bags are made of. Sometimes what is appropriate is to take some of that fat out through a surgery, but sometimes what's appropriate is to put some filler in the crease between the bags and your cheek so that we kind of mask that bag. But it depends on what your face actually looks like, and that's why it's very important that you make sure you're seeing a physician who has a lot of experience with this in consultation before you do anything.
So the common kind of the traditional approach is just scoop it out,
Right.
but really sometimes you need to build it back up, so you're kind of throwing the light back
Exactly.
out there. You're kind of playing with lights and shadows.
Exactly. And Vicki, you could just do the consults for me. But that's and it's very important that both options be explained to you when you come in for consultation, so that you are making an educated decision about what you want to do.
For our viewers, I am not a doctor. I just play one on TV.
Yeah,
No.
right.
All right, thanks, Joanna. I want some people do confuse fillers with the Botoxes or the, what are we calling now, Dysport?
The botulinum toxins. And so it's very important, and this is part of what we do when you come in for consultation. The Botox, or now the Dysport, will weaken or paralyze the muscles of facial expression. So when you frown and you make two crease lines between your brows, Botox will prevent that frown from happening. What the fillers do is fill in wrinkles that are already there.
Okay.
So it's very important, and sometimes they work really well together, and you need them both to get the best cosmetic result.
They're not mutually exclusive. In fact, sometimes
absolutely not.
It's kind of the harmony between. Now, you say you have a patient, they come in, and then they come back 6 months to a year later. Would you necessarily do the same formula, or because gravity and then a person's own aging process?
We reassess every time. And so that's exactly right. What patients need each time may be a little bit different.
How about the downtime, really quickly?
The downtime is minimal. You can get, the major problem with injectables is that when I'm sticking you with a needle, you can get a bruise. And the bruise can take, up to 2 weeks to resolve. But for the most part, there can be some swelling, some soreness, not with Botox or Dysport, but with the injectables. And so Fridays are a busy injectable day.
I bet. Unfortunately, we are out of time. Thank you so much, Dr. Lee. I hope to have you back. And for more information about Dr. Lee, call her 510-704-2170 or go to artfulsurgery.com. Join us again.